Dr. Andrea Fiegel, let me begin with you. Now, let's just go back to that figure, which is 2% is dedicated to mental health care of health budgets on average in countries. Why such a negligible amount?
Very little training, consequently, that allows the diagnosis and the care. For example, we talked to an official from Sri Lanka a while ago, and she told me that they had virtually a zero budget for mental health. So the reason is just it's under-recognized, and there's a massive stigma around having a mental health disorder, yet the problem is quite large globally and especially in developing countries.
Dr. Andrea Fiegel, studies figures that almost every 40 seconds there's a suicide in the world. Almost 1 billion people are suffering from mental disorders. How is it that this continues to be ignored? Do you think it is because there isn't enough awareness on it, or because the efforts made to actually address it are continuously being undermined?
Dr. Tedros called chronic conditions a slow-moving disaster. So, for example, as bad as the COVID pandemic is, everyone can be infected by it, and it's a very fast-moving virus. Mental health conditions can cause people to suffer in silence, and there has been a lot of stigma when you think about in terms of hysteria, in terms of acting out when people have bipolar or schizophrenic disorder, so that a lot of people try to hide it. So I think that is one of the main reasons, and as unfortunate as COVID is, it does shine a light on chronic conditions, including mental health. So we do have a window of opportunity to push for legislation and to push for some of the solutions that are really very much long needed.